we are spending billions and trillions of dollars for Band-Aids. We're talking about Band-Aid care, put something over it, as opposed to look and find the underlying cause. Brain creates what we experience. How do we see? We don't see with our eyes. We don't. Light comes in our eyes, but the light impulses have to be transformed electrically through the visual cortex to create the images that we see. As neuroscience research shows that emotions and stress activate the exact same parts of the brain as does a physical injury. And we can talk about why our brain might do that. We don't know for sure, but whether God created us that way or we evolved that way, but that's how our brain works. So the pain that occurs due to a fracture is exactly the same as the pain that occurs due to a stressful situation that occurs in our life. It's real pain, and it can be severe pain. And that's what people say, how can the pain be so frigging severe and not be due to a structural injury? It's amazing, but it's true. We see it every day. The pain is not the problem, it's the solution. And so when you break an ankle, it's not your ankle causing pain. An ankle can't cause pain. The impulses go to the brain, but the brain decides whether to actually turn on pain or not, whether to give you the experience of pain or not. How do we know that? Because a lot of people have experienced themselves, you get an injury and you have no pain at all. So the brain decides whether to turn on pain or not, and it's there to protect you. It's something that everyone needs. It's like a smoke alarm. Yeah. And we see so many surgeries that are being done on people's necks and backs for treating the MRI, not treating the patient. And there's never been a randomized control showing that surgery for neck or back pain, axial pain, is better than watching it or exercise or physical therapy or anything. There's no evidence that this is what we should be doing, but we're spending billions of dollars, trillions of dollars, billions. But it's not that so much, it's that it also makes people worse. Because what happens is in the brain, we'll talk more about this, what happens in the brain is that the more you're fearful of every time, if you have back pain, the more fearful you are of it, it's going to get worse over time. Because the neural circuits in the brain, you're getting a positive feedback loop, whereas pain leading to fear, focus on it, worry about it, frustration with it, it actually makes it worse because that's how those neural circuits work. The signals that go to the brain go up through the peripheral nervous system, through the spinal cord, into the brain, into several centers of the brain. And the different centers of the brain have different functions, somatosensory centers and emotional centers and thought centers and memory centers. All those things are activated when you get these kinds of nerve signals coming up to the brain. The brain then has this pathway that's sometimes becomes a default pathway of neural circuits that keeps turning on pain every time you wake up in the morning or every time you bend over as a conditioned response. And so then those neural circuits become activated sometimes all the time or coming and going or in whatever pattern occurs, but those neural circuits are real and they're causing real pain. But it's not because of the injury. So that's the critical thing that we and physicians and PTs and everyone need to understand, to look carefully, to really listen to people of what happened with the injury, what happened with the healing, and what is the history of the pain. Because if the pain is turning on and off, structurally, if you break your arm, the pain doesn't turn on and off.
Yeah.
If you go away on vacation, it goes away, and you come back to work, it comes back again. That's a neural circuit problem. If the pain is triggered by stress, if the pain is triggered by the wind or cold or the weather, there's all these signs and clues that we have as physicians and other professionals to listen to people. And the one solution that we're calling pain reprocessing therapy, and the other type of solution that we're calling emotional awareness and expression therapy. So the first one dealing with the neural circuits in the brain directly, and the second one dealing with emotions. And in our Boulder back pain study, 44 were treated. Of those people, 33 were pain-free in 1 month. So 75% of the people we treated were pain-free after 10 years of back pain in 1 month, simply using what we're calling pain reprocessing therapy. The major cause of disability worldwide is chronic neck and back pain, headaches, anxiety, depression, irritable bowel, fibromyalgia, etc., etc., etc. Never underestimate the power of the brain to create severe symptoms. So not all injuries cause pain.
Okay.
Number 2, it's the guy in Britain, a construction worker, jumps off a scaffolding onto a nail sticking up in the ground. The nail goes completely through his boot. He can see the nail sticking out on the other side of his boot. He starts screaming in pain. He has severe pain. They rush him to the hospital. They give him IV pain medication when he gets there. And they take his boot off, and the nail is right between his toes. There's no injury at all. Is his pain real? Yes, because all pain is real. All pain is created by his brain, and his brain predicted, and the science of the brain is called predictive processing. His brain predicted that he should have pain based on the nail. It just made an error. But it created this pain, and the pain is real. When the mind is ill at ease, the body suffers. You just interrupted that pain cycle by giving the danger signal in the brain these calming and safe messages. And that's what pain reprocessing is at its core. And we've got a whole bunch of techniques of how to do that so that people can, step it, do this, do this, do this, change your relationship to the symptom and see what happens. And then when you start investigating, looking, oh, hey, it hurt then, but it didn't hurt then. Oh my God, it is my brain. Oh my goodness, I'm going to be okay. And then there's that relief. Once you've done the understanding part of it, and then you start doing this pain reprocessing part of it, of lowering the fear reaction, beginning to start moving again and challenging any of these triggers by smiling at them. It sounds silly, but the pain is not the enemy, is our message. So if you have a child lying in bed fearful of a monster in the closet, you're not going to be mad at the kid, hopefully. You're going to open the closet door, say, look, there's no monster. You're okay. Lie down with them. Tell them you love them, that you're okay. Read a story, get them to laugh. They'll go to bed, right? That's how we're treating the brain, because the brain is just fearful. It's worried about you in the sense of causing these symptoms. When a kid falls off a bike, they look to you to see if they should cry or not. And if you freak out, they cry. But if you smile and say, oops, that was fun, then maybe they don't. So this is this pain reprocessing part. Now, meditation can fit into that because we use mindfulness meditation type practices in this work. And I've been teaching mindfulness since 1999. And everyone should learn mindfulness. There's no one who's studied mindfulness who doesn't agree with that. Children, everyone should learn it. It's basically created by the brain. And now if you can observe that, now you can step back from it and observe it and just watch it and not try to fight it and be frustrated by it, but set that aside and then be with it and see what happens. And then maybe it shifts. Maybe it gets a little worse. Oh, my brain just made it go up. Oh, that's interesting. What's going to happen next? Oh, it just went down. Oh, that's interesting. Oh, it moved over here. Okay. And all of a sudden you see, and then it really, as you said, it drops. All of a sudden you get it. And then, so meditation has a really important role in this, but not just meditate.
Yeah.
Understand and use the tool in a way which is going to help reverse the pain as opposed to cope with it. Because what you're doing is you're making yourself feel safer. You're calming the danger signal, the autonomic nervous system responses and all that sort of stuff.
Yeah.
You're calming it and you're giving yourself a sense of control that you can do something. And yoga, of course, is beautiful because you're pairing that with movement. You're pairing the calming and the reassurance and the joy with moving your body. So neurons that fire together wire together. So when you're moving with fear, you're reinforcing these neural circuits of pain, fear, pain. But when you start moving gently with calm or with joy or with control or with peacefulness, now you're training your brain that these movements are not dangerous, and those neural circuits start to get ingrained. So journaling is part of the techniques that we would use on the second part of the treatment, not the pain reprocessing part, but the emotional awareness and expression therapy, which we've developed and worked on. It has components of intensive short-term dynamic psychotherapy. So if you put kind of those things together, you start to deal with the emotions of it. And that's a whole nother area that can really lead to healing on the inside.
Yeah.
Not just recovery from the symptoms, but using the symptoms as a way to decide what's important in your life. So that's a whole nother area that we can discuss as well. And if someone's suffering with severe pain due to a neural circuit type problem, they may need pain medications while they do this work. We've had in the medical profession recently is people are put on forced reductions of opiates and saying, okay, you're going to taper. And what happens is now you get what's called, as I'm sure you're aware, the nocebo effect kicking in. So people are fearful that their medications are being taken away from them forcefully. And now the pain is going to be worse because the brain is put into a bigger state of fear, and lowering the medication is much harder. So we try to first just stay on your medication. Let's see if we can get you out of pain first. If we can get you out of pain using these methods, then tapering that medication is going to be easy. The pain, this happened in my life and the pain went up, or this happened in my life and the pain went down.
Yeah.
Or it's inconsistent. Why is it happening sometimes and not other times? And now that you have a framework for understanding that, you can say, maybe it is my brain after all. Wow, wouldn't that be something?
Yeah.
And being treated, in that pejorative way. But if we can also strip away some of the diagnoses and some of the words that people have been given, like incurable and bulging discs, and the names, it's chronic fatigue. And there's so many names. I don't know if we have time to get into it, but so many names have been given to people. Oh, you've got chronic Lyme disease. You've got Ehlers-Danlos syndrome. You've got, your posture's all bad. All these things, if we can just start over, strip away the unkindness and strip away the incurable, and start in a middle place with investigating carefully and taking time to look at people's lives and look at their symptoms and see what you can find.
Yeah.
Because when you do that, usually you'll see, maybe there's something here that we can work on. Evaluate it. Like I say, as physicians, everyone needs an individual assessment.
Yeah.
And do you really is it really chronic Lyme? Let's look at the tests and let's look at the symptoms. With long COVID, if you look at the symptoms very carefully, I saw a woman and there's a lot of research on that now, research showing that people with pre-existing anxiety, depression, loneliness, fear are more likely to get long COVID than those who don't have that prior to getting COVID. There's research showing that people who didn't have COVID had as high or higher rates of long COVID as people who actually did have COVID in a large French study. And if you just take each person as a unique individual and just look at them, talk to them, do the testing, if there's no explanation for it medically, and the symptoms are brain fog and fatigue and aches and pains and diarrhea and headaches and anxiety and depression, and it's all there, what's the harm in looking at it closely and looking at it from this lens of neural circuitry? What's the harm in just looking at it? I had a patient who had long COVID. Young woman had it for about 1.5 years, really bad. And she saw me, just one visit. And 2 weeks later, she was 80% better. It was amazing. But what was really interesting is she had loss of taste and smell, which is part of COVID, right? You get COVID, you get loss of taste and smell. That's got to be a structural problem, right? I mean, how could it not be? Well, she had loss of taste and smell for 18 months. And then I saw her one day. And then the next day, her taste and smell returned. And then the day after that, it was gone again. And then it returned again. And then it was gone again. Her brain had the capacity to turn on and turn off this thing, which seems completely neurological, and it's certainly real, but the power of the brain is immense. And if we're just open to that, that's all I'm saying is I'm not judging people or assuming that what they have because of their label is or isn't real, but it's taking the time to investigate it in a careful and compassionate way. That's what I'm trying to say.
What did you do with that lady?
Oh, well, just what we do every day. We went over her whole life and the story, linked stressful life events to her situation, looked at the symptoms that she was having, the brain fog, the fatigue, all the testing that she had, making sure that there was nothing structural wrong. And then we started having her change her relationship to her symptoms, knowing that she could get better.
Yeah.
Starting to smile, starting to move, starting to reassure herself little by little. And that is what, and then she saw the symptoms shift, get better, get worse. And she said, oh my God, it is my brain. And then they started getting better. The power of our connection to each other, our social connection, the power of what goes on in our lives is immense and has tremendous impact on how we live day to day. And there's just so much suffering in the world, so much suffering that I think we can do better. And I think we're just trying to point the way little by little, step by step, to doing a little bit better. And every patient that I see, they ask this question: how come my doctor didn't tell me about this? How come people didn't know about this? How come I never heard about this in the last 5 years or 10 years or 20 years of suffering? How come nobody told me that there was a different path? And it's not for everybody. And I don't expect that everybody who's listening is going to like, oh, yay, we found the way. But some people will.